Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kathleen Muldoon, professor, medical educator, and coach. Today's Kevin MD article is Why Humanity in Medicine Requires Peace with a Spine. Kathleen, welcome back.
Thanks for having me.
All right, tell us what your latest Kevin MD article is about.
So the latest piece came about because I've been sitting with, especially in my roles, right? I see in these medical spaces people at several stages of their careers. So I see students in their first and second and third and fourth years of training. And then I see through coaching clinicians who come back and want to unpack, some of the ways in which a lot of times, sometimes it's their training that
Mhm.
has gotten them into a place that doesn't feel right or good or misalignment in their career path. And in the context of the last few months, and maybe even especially the last few weeks, the idea of what peace means in clinical spaces kind of came to the forefront of my thinking because I've had several instances where, people have come to me and really wanted to discuss some of the hardships that medicine is going through right now. And we've talked before about how clinical spaces can feel very polarized
Mhm.
and people don't know, I think, how to use their voice as clinicians to address some of the policy changes that are happening that could be in the hospital systems or statewide or nationally. And so, what does it mean to kind of use your voice, especially when, in a lot of cases, clinicians and caregivers and anybody in the caring professions can feel like keeping the peace means holding your tongue or
Mhm.
being silent. And that doesn't feel right to a lot of people right now. So I started thinking about, what does that actually mean and how's that tied to the larger themes that I tend to think about, which are, humanity and medicine.
Now, how did it get this way? What are some of the reasons you think why physicians are so hesitant in expressing some opinions?
I think it's the idea of clinical detachment can sometimes be, I think, emphasized in a way that can be interpreted as smooth out your edges. Leave your humanity at the door because you're there to treat the person in front of you, and that's your only job. So all of
Mhm.
these larger systemic issues, they don't matter. But the truth is, it's the container that is framing the way you practice,
Mhm.
maybe how that person came to be in your clinic, the interactions that everybody's having in those the hallways, the clinical spaces, all of those things. And so I think that the idea that has become in some spaces kind of implicitly embedded that professionalism means leaving your humanity at the door, biting your tongue, not engaging in difficult conversations, and that coupled with just the hierarchical nature of clinical training and the power dynamics, like am I going to is this going to affect my audition rotation? Is this going to affect my promotion? Is this going to affect my evaluations, right? If I say something, and I think having a skill set to bring peace into a conversation. It doesn't have to be these grandiose things that upset the whole, hierarchy, but can be very simple skills that we exercise every day.
So you imply that there is a little bit of a fine line, right? Because, like you said, there's a
Mm-hmm.
skill set to expressing an opinion, but doing it in a way that doesn't get you into trouble with the traditional medical hierarchy. And you mentioned that there is a connection in terms of how physicians are trained and some of the issues that come up later. So, what are some of the skills? Like, how do we balance that? How do we thread that needle?
And I want to address something you said too. And it's not always just expressing your opinions, right, or making your opinions known. But instead of getting offensive or getting defensive, I should say, because we do all have opinions, right, and we
Hmm.
don't leave them at the door, and they are going to affect how we interact with each other. But I think the skill set is a very clinical and a very professional one. Is like staying curious, like
Yeah.
staying in the moment when something feels off to you, when you feel that impingement, like what do I do in this situation, then pause.
Hmm.
You know that is an easy thing to do. Take a pause, take a breath, because even visibly taking a breath creates, in your autonomic system, right, that like sense of safety for yourself but also for people in the room. I think we need to normalize naming what we're feeling, because the idea of everyone kind of having this sense of tension in the room, but just letting it go without saying anything, that can cause a lot of harm. So I think even something as simple, which is not challenging, right? To just say, I'm feeling a little tension here. Are you feeling that too? Or I just want to make sure I'm observing the same thing that other people are. I think that is a way to diffuse tension, again, without, getting into personal politics or opinions or whatever you feel, right? So I think those are some simple steps right there that are easily practiced in clinical spaces as well as in interactions in professional spaces.
So I'm hearing three things. Number one, staying curious. Number two, sometimes taking a pause. And number three, sometimes naming what people are feeling. And sometimes it could be uncomfortable, but explicitly naming it sometimes can diffuse that tension. Now, give us an example. It could be through a medical education sphere or through your coaching where some of these strategies can come into play. So what would be an example of that?
So one example that's come up recently was through the coaching space where somebody who works, as many people do, especially in hospital systems, in interprofessional settings, where there are clear role boundaries. And a patient brought a concern that was being dismissed, and somebody in the nursing profession who, is not the director of clinical care, but felt that the patient wasn't being heard. And so this is somebody who understands that there is some danger, right, to being able to navigate a situation that is interprofessional. And, was replaying a scenario with me in which they did just pause the conversation, literally said, I think, can we pause the conversation here? And maybe it's good practice for us to all put in our words about what is happening in the
Mm-hmm.
situation. And even doing that in the situation of a rounding event was that they came to understand by the way they were able to paraphrase the main concern that they weren't all on the same page with each other, let alone the patient. And I think it wasn't somebody telling another clinician that they were wrong. It wasn't putting a student or a resident into a place, although this nurse did say that she could tell that the student was feeling uncomfortable in the
Mm-hmm.
moment in that situation, but just naming it. And then they went back to the patient and they just said, we just want to make sure that we're understanding you correctly. So it was a benefit to the whole team. And it turned out that, they were able to get clarity and provide a better clinical path forward.
In your article, you make the distinction between real peace and false peace, right? So tell us more about that distinction.
I think it goes back to this idea that not rocking the boat, smoothing out your edges, staying silent, even if you do notice something throughout your day, saying something like, I'll deal with that later, or, I'll come back and have that conversation another time. That I have noticed has led to almost a feeling of numbness.
Mm-hmm.
I think that's one of the things that sometimes clinicians come to me is that they can't stop replaying different situations when they go home from work. And one of those are times where they feel like they should have said something and they didn't, or it should have gone somewhere. And I think that kind of silence where you sense that you took a course of action that didn't honor your own instincts or your own gut, or even take a moment to even check with yourself, which you can also do in small ways, a little note to a pad that you keep in your pocket. That kind of silence, that kind of peace is silence. And I would call that a kind of a false sense of
Mm-hmm.
peace. Like it may be comfortable and things may feel peaceful at work, but peace with a spine or courageous peace doesn't always feel peaceful, like you said before. And I think it is understanding that there is an element of moral courage to being a clinician, and there is an element of advocacy that means, naming things when they feel uncomfortable, pausing a situation when they escalate. I even as a parent or as a patient myself, sometimes, it has struck me that over the past few years, there are so many signs up now that say we will not tolerate inappropriate behavior towards our clinicians. And I understand that it's necessary, because of the tension that can occur in these clinical spaces. And I just feel like that courageous kind of piece is naming something that it feels tensions and as a way to kind of diffuse this. Another example that students come back to me a lot of times as they're learning to take the clinical history in pediatric settings is, that part of the questionnaire is, are there guns in the home?
Hmm.
And that can feel like a very tense question, especially when a parent might answer, it's none of your business, right? But pausing there and saying this is part of the history and part of for safety reasons, so that we can make sure that there's appropriate storage, etc. And being able to have that conversation can diffuse, because it's not that person reacting that way, they're coming from their own framework that you
Hmm.
can get curious with them about, right? And they may be hearing something else in your question that relates to a belief system, a political orientation that may not be the intention of the question, right? It's really about like, you're here because you care about your kid. I also care about your kid. This is one of the questions that we're asking just to make sure that your child stays safe. So I think that being understanding that kind of thing is part of your job, and it might not feel comfortable, but having the courage to not shift that tension under the rug, but engage with it fully, I
Hmm.
think really prevents some of the long-term implications of hiding your feelings, those gut reactions, of the rumination that happens when you can't turn off your brain after encounters during the day, and not allowing that to turn into the kind of numbness that kind of feeds into some of the longer and larger issues that we see in professionalism these days with moral injury, burnout, et cetera, et cetera.
And you alluded to guns, and it's not just that in this political climate, right? Vaccines, for instance, and sometimes
Yep.
that can lead to potentially tense situations. Now, when you teach students, and I'm sure a lot of clinicians can use your help with this, how do you go about teaching that? How do you teach your medical students how to conduct a history and sometimes talk about politically charged topics in a more detached way? Like how do you teach that?
So we do, and we talked before, I do a lot of improv or
Hmm.
theater-based techniques where we do, sometimes it's role playing, and sometimes it's even that we put up scenarios and we name our own reactions to
Hmm.
them so that we can practice what that feels like. Because, as like psychologists say, you name it to tame it. And if you're not in touch with what it feels like to you, because let's face it, especially in medical school, you just kind of go like one thing to the next thing to the next thing. You just go, 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 go. So understanding that pause is part of your professionalism training is one of the things that we do. So we put up highly, charged scenarios that have either come to me and then I've anonymized through my coaching work or on social media, etc. And I ask them to notice their reactions, and then I say, okay, like what's the core value of this person? When we have an exercise where I ask them to introduce the person who's wearing that slogan on their t-shirt, the patient, and I say, okay, this is my friend, Pat, and their core value is blank. And so meeting from that space where you're curious about where this is coming from, like where you can connect with them because you also care about the safety of that child. And then you're able to build forward because we know that shoving facts down somebody's throat, right, is not the way to get them to change their mind or decrease tension in any situation. And so I think understanding that you're both human and connecting from that point allows you to move forward. We play other games that play with the like power dynamics
Hmm.
and understanding, when I put them in situations where I've given them undisclosed positions of power in different hierarchies, and even in like a non-clinical role play setting, I tell them to act as if you have this status and just noticing those behaviors and mannerisms and stuff that come out even in exaggerated ways, and how it makes you feel. For example, if you're at the top of the heap and if somebody else is at the bottom, like then after the game is done, say, look at who has, just reminding them like who has the power in this room right now, right? And they'll say me, and I'll say,
Hmm.
yeah, well, how have I democratized that? Or who has the power in a clinical space? Is it the patient, or is it the doctor and just calling to attention in a way that I hope plants seeds that gives them the skill set to pause when they're later in the clinical setting or as they move through their training to remind themselves that, you know, they're seeing the people in their most vulnerable positions, often on the worst day of their life, and tensions can run high. And sometimes those emotions mask core values
Hmm.
and can seem more polarizing than they actually are. So it's not setting yourself aside, but it's staying curious, having that empathy, understanding that you have a lot of power in that human interaction to navigate a situation that is creating a sense of peace for yourself and for that person in that clinical moment.
We're talking to Kathleen Muldoon, professor and medical educator, as well as a certified coach. Today's Kevin MD article is Why Humanity in Medicine Requires Peace with a Spine. Kathleen, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I just want to remind people that, you know, in every interaction, it can feel, especially in medicine these days, that there are like so many large and polarizing and systemic issues that are ours to solve. But making a human choice in a single interaction is a very powerful way to move with peace and humanity through your day that will help both you and your outlook on your own professionalism, but really change the course of interaction for your patients as well. So just stay human, stay in those choices.
Kathleen, as always, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thanks for having me.